Hello, my good people. It's yet another day whereby we bring you our day to day educational bangers. We are dealing with one of the best topics ever about dehydration, which arose when we were discussing about diarrhea. Because when you talk about diarrhea and vomiting, you must touch dehydration, which is a major complication for both diarrhea and vomiting. And before we continue, I always appreciate you people for the support you are showing me, for the subscriptions, for the likes, and for the comments. This channel is growing rapidly because of your combined efforts and holding your hands together as a one family. Let's continue subscribing, liking, and sharing our videos so that our channel might grow bigger and bigger. Dehydration signs or signs of dehydration in young children or in babies. That is the topic of the day, or the topic we are going to start with among others. An dehydrated infant or a child may not show same signs of dehydration that adults do show. That means signs of dehydration in adults and children are completely different. They are not the same. Why? Children have higher metabolic rate compared to adults. So, a dehydrated infant or child may not show same signs of dehydration as an adult do, make it hard for parents and caregivers to identify potential dehydration. So it's hard for the parent or the caregiver to identify or to know whether this child is getting dehydrated or not. Infants and kids. Infants and kids are more susceptible to dehydration caused by diarrhea, fever, and vomiting because kids have a higher metabolic rate and lose more water on daily basis compared to adults. I hope you get this very clearly, that infants and kids are more susceptible to dehydration caused by diarrhea, vomiting, fever, and diarrhea, vomiting, fever, because kids have a higher metabolic rate and lose high amounts of water on daily basis compared to adults. A point to note: babies and young children depend on caregivers for hydration or rehydration. Babies and young children depend on caregivers for hydration or rehydration. Signs of mild to moderate dehydration in babies and young children include the following. So, what are the signs and symptoms of mild to moderate dehydration in young children? 1. Less frequent urination or decreased urination rate. Less frequent urination or reduced urination rate, which is fewer than 6 wet diapers in a day. Fewer than 6 wet diapers in a day. Number 2, the child might be playing less frequently. We have fewer tears while crying, or the child might not be producing tears while crying. We have dry tongue or lips, sunken fontanelle, sunken fontanelle. We have diarrhea or constipation depending on the cause of fluid loss. We have extreme agitation. We have extreme fatigue, cold feeling, discolored and fit, cold feeling, discolored and fit. We have wrinkled skin or odd man's look, minimal urination less than twice a day, low blood pressure or reduced pulse rate. We have increased heart rate, altered mental status. All those signs are indicators of dehydration in children, kids, and young children. A point to note: babies and children may not show same signs as adults. Contact your doctor if the baby is having signs of dehydration. So babies and children may not have the same signs of dehydration as adults, so you should contact your health caregiver if the child or the baby has signs of dehydration. So what are the ways you can apply to reduce chances of dehydration, or how you can reduce chances of dehydration? Number one, if child is sick, for example, the child is having diarrhea, vomiting, replace fluids or rehydrate with water and other beverages. For example, electrolyte drinks, foods in high fluids, fruits, soups to prevent dehydration. Number two, if you are experiencing symptoms of dehydration, increase fluid intake. If you are experiencing signs and symptoms of dehydration, increase the fluid intake levels. Increase the fluid intake for this child to avoid dehydration. Hydration needs or rehydration needs vary widely and depend on factors like activity levels, body weight, pregnancy and breastfeeding status, and environment. Hydration needs vary widely and depend on factors like activity levels, body weight, pregnancy, breastfeeding status, and the environment. A very important point: water recommendations for adult women is between 2 to 3 liters per day. In adult men is between 2.5 to 4 liters per day. And this marks the end of our first video today. Let's meet in the next video and let's continue keeping the support on and makes this channel a success. Let's meet in the next video.